How does glucose relate to a diabetes diagnosis? Imagine your blood as a busy highway, with glucose as the cars moving through it. When everything works well, insulin acts like traffic lights, helping glucose get into your cells for energy. But in diabetes, this system breaks down. Blood glucose levels become too high because the body isn't using or producing insulin properly. That's why measuring glucose is key to diagnosing diabetes. Doctors use several tests to check blood glucose levels. The first is the A1°C test, which looks at how much glucose has attached to hemoglobin in your blood over the past 2 to 3 months. If the level is 6.5% or higher onto separate tests, it means you have diabetes. If it's between 5.7 and 6.4%, it's called prediabetes, which means you're at risk of developing diabetes later. The A1°C test doesn't require fasting, making it easier to do. Next is the fasting plasma glucose test. This measures your blood sugar after you have not eaten for at least 8 hours. If your fasting blood glucose is 126 milligrams per deciliter or higher onto tests, it confirms diabetes. Levels between 100 and 25 milligrams per deciliter suggest prediabetes. There's also the random blood glucose test. This test checks your blood sugar regardless of when you last ate. If your blood sugar is 200 milligrams per deciliter or higher, and you have symptoms like frequent urination or feeling very thirsty, it's a sign of diabetes. The oral glucose tolerance test is another option. It measures your blood sugar before and 2 hours after drinking a sugary beverage. If the 2-hour reading is 200 milligrams per deciliter or more, it confirms diabetes. Why do these tests focus on glucose? Because diabetes happens when your body can't control blood sugar properly. Either your pancreas isn't making enough insulin, or your body's cells aren't responding to insulin like they should. This causes glucose to build up in your blood, which over time can damage organs and tissues. The thresholds for these tests are based on research showing that high blood glucose levels increase the risk of complications like damage to the tiny blood vessels in your eyes, called retinopathy. People with an A1°C below 6.5% rarely develop these issues, which is why these numbers are used to diagnose diabetes. Getting tested early helps catch diabetes before serious problems develop. Once diagnosed, monitoring your blood glucose regularly helps you and your healthcare team manage your condition. It guides treatment and keeps your blood sugar within healthy ranges. In simple terms, glucose levels tell us what's happening inside your body. When they're too high, it's a sign that your body isn't managing sugar well. That's why measuring glucose is the main way doctors diagnose diabetes. It's a clear, straightforward way to see if your blood sugar is in a healthy range or if it needs attention.